Welcome to tonight's panel with current Mercy volunteers. We have volunteers who have served in education, healthcare, and social services tonight. So if you all want to start by introducing yourselves, tell us who you are, where you're serving, and where you're from. And Rachel, if you'll start.
Hi, my name is Rachel. I am from Sacramento, California. I am serving currently in Philadelphia at an organization called Project Home. And they do all sorts of different things, but I work in the homeless outreach aspect of the organization. And I went to school in Newport, Rhode Island at Salve Regina and was a social work major.
All right. My name is Nolan. I'm from Racine, Wisconsin. I went to Viterbo University, which is a little nursing school in Wisconsin as well. And I've been serving at the Good Samaritan Clinic in Garden City, Georgia, as a registered nurse. And we do mostly primary care for all of our patients, and our patient population is mostly Spanish speaking.
And I am Emma. I am from Minnesota. I'm currently serving in New York at Catholic Migration Services, which is a legal service organization helping low-income immigrants in all 5 boroughs, but particularly in Queens and Brooklyn. And I graduated from Notre Dame last spring, and I majored in political science when I was there.
Awesome. Thanks for being here. Looking forward to hearing more about the work that you all are doing and the work of your service sites. For those of you watching, if you have any questions throughout, please feel free to chat us those for our volunteers to answer those live. If you could tell us a little bit about what your service site does and what the mission of your service site is. Nolan, if you want to start on this one.
Yes. So the mission is to provide healthcare to people who otherwise may not be able to afford or have access to healthcare. So all of our patients do not have insurance. That is a requirement. And all of them are in need of primary care. So with primary care, they see one of our 2 nurse practitioners, and they function as their doctors. They also get their labs drawn so we can see how their values are. We provide lots of education, and we connect them with different specialists that they may need to be in contact with. Aside from that, we do various screening tests and kind of get them covered in a holistic way, seeing what their healthcare needs are, and then also thinking very thoroughly and seeing what are some of their other needs as well.
So yeah, at Catholic Migration Services, we serve immigrants in all 5 boroughs. Mainly our biggest unit is the immigration unit. So that takes anything from removal defense, as in like when people are seeking asylum to stay in the United States or they're already in deportation hearings or something, our lawyers will defend them. We also do affirmative applications, like people wanting to apply for someone who is abroad, a relative, a spouse, different things like that. We help with those. My role and the team that I'm on does naturalization. So that is lawful permanent residents who want to become US citizens. We help them with that application. So all different types of immigration inquiries and legal cases we do. And then there's also another unit that's focused on workers' rights, and they help with different wrongful termination suits, different things like that. Again, focused on immigrants in the 5 boroughs. And then we also have a housing unit, which helps tenants with various different cases, everywhere from, staying in their places and not being evicted to getting payments or repairs done, different things like that. So the clientele is, like I said, immigrants in the 5 boroughs. There are some, for certain programs, they have to be under a certain level of income, usually like 200% of the poverty line or lower. But for other programs, it's different depending on the grant we're working under. but mainly it's just helping them get their legal needs met in a way that is no cost. We don't charge for any of our services, so it's a free legal services organization.
So the main mission of my service site essentially is to empower folks, empower children, adults, and families to help to break the cycle of homelessness and poverty. But I feel like they really do a great job at really meeting people where they are. Because we have 24-hour homeless outreach where outreach workers will either respond to response calls to our hotline, or they have specific zones in Philadelphia that they have to monitor each day. And really meeting people where they are, seeing what they need. If they're interested in shelter, we can assist them getting there, or if they just need something to eat, we can give them resources on where they can go. A lot of the folks that we work with, there's definitely an intersectionality of folks who are struggling with mental illness and substance use. So also helping them to seek resources for that. And recently, early on this year in February, Project Home actually started the first ever street medicine team in Philadelphia. So most days out of the week, my partner and I have a nurse or a nurse practitioner with us, and they're able to do anything in between primary care to just wound care right there on the street. So really just really meeting people where they are and helping to empower them to eventually seek medical services on their own or shelter services, and to really get them where they need to be.
Thanks, everyone. Can you tell us what your role at the service site looks like? Maybe what a day in the life is for you as the Mercy volunteer there, Emma?
Yes, so I serve as a counselor, which is like a case handler. And so I have like my own client list, clients who I take from the moment they reach out to our organization until we've turned in their application, and even sometimes until they have naturalized and become a citizen. So I essentially, there's a lot of different things that go on during that process, but starting with, intaking the client, speaking with them directly, hearing their needs and their case, and then doing everything that needs to be done to get them to citizenship. So that's a lot of document collection. It is a lot of sometimes writing affidavits or collecting testimony of different things, just different things depending on the case that you need to do in order to ensure that their case is as best as can be to naturalize and become a US citizen, or to make sure that we advise them correctly as to whether they should or should not apply to become a US citizen, and how DHS and how the immigration unit of the government will look at that case. So a day is, calling my clients, collecting documents from them, sometimes dealing with DHS and USCIS, the immigration entities in the government, to figure stuff out for them, calling other government agencies to try to request arrest dispositions, different documents. So a lot of that, meeting with clients, doing some paperwork and stuff, legal paperwork, and then coordinating with my team and the supervising attorney who we all work under. That's essentially what my day-to-day looks like. And what's very unique is that there's actually multiple of us, like 1-year volunteers in our small unit. So it's really nice because it's very much a program that they're used to, and that, 3 always transition in and out. It's not just me, there's a few others too. So it's been going on for like 8+ years now. So it's a very good system and good team to work with for this type of work.
So my day-to-day, so 2 days a week, I work on our 24-hour hotline. And this is a phone number that anyone in Philadelphia can call, whether you're experiencing homelessness or you see someone experiencing homelessness and think that they just need someone to check in on them. And from there, we then send an outreach team to meet that person. And sometimes they don't want anything, but then what it's really about is relationship building. So that outreach worker now knows if that person hangs out in that area, they can check back in. And eventually, sometimes you don't even get a first name, or they just don't even want anything. But then that next time, or the third time after that, then they tell you their name, and it's just kind of like building that relationship afterwards. And then 3 days a week, I go out on outreach. And so we will either respond to response calls, or kind of go in our zones, like I was saying earlier. And we have like a group of maybe 25 people that we're currently regularly working with. And so with them, it's really connecting them to services. So there's a few folks who currently are using and want to seek methadone treatment. But there's steps to kind of get to there. They have to have an ID. So we've been trying to help folks get their ID before that they can then seek those other services. So yeah, and then some days I don't even know what will happen if we get a response call. Like this morning, we got this response call in University City, and it took like 3 hours working with this gentleman, and he just wanted to talk and had so much to say, and wanted to tell us his whole life story. And it was just so great just being able to kind of build that relationship, because sometimes, like I said earlier, like people don't open up as easily, but then this gentleman wanted to tell me his whole life story. So I really love the work that I do, and just take it day by day and to see what happens next. But
All right. So my role at the Good Samaritan Clinic is a registered nurse. So at the clinic, we have medical assistants and we have nurse practitioners. So being a registered nurse, I can kind of float in the middle. And I would say my biggest role is that of being flexible. I can do things towards each of the ends of the spectrum in getting things done, of doing assessments or doing vaccinations, immunizations, and whatnot. A typical day for me looks like in the mornings, I have my own schedule of people that I see as I run the laboratory. We have a separate full laboratory room. And so I have about 10 to 15 people a day who come in, and I'll sit down with them, have a chat, draw blood, get a urine specimen, run various tests, and prepare the samples to be sent out. That takes up most of my morning, of making sure that everything is running how it needs to be in the lab and everyone's doing well. In the afternoon, I can be a lot more flexible and help out the medical assistants and the nurse practitioners with really whatever they need. That could be in the form of going in the patient rooms and doing electrocardiograms, the EKGs, doing various education with them, like diabetic education, whether it be dietary, whether it be how to use their new medications, what are their new medications, how to use insulin, how to test their glucose, things like that. Also, I can jump in and interpret for the two nurse practitioners. I think a flow that we've gotten into is doing the blood draw with the patient, coming back, I'll do the vitals and whatnot, and then I'll go in with the nurse practitioner, translate for the patient, stay in the room, do the education and whatnot, and then guide them to the front. So my role is kind of seeing it through all the way to the end, of putting out a bunch of different hats in between and making sure that the patient has continuity of care. Yeah, so that's a pretty typical day. I do take on some additional responsibilities, like running vaccination clinics. For example, during flu season, we had a shipment of 150 vaccines come in, so getting folks prepared. And helping with minor stuff too, like wrapping up hands and doing some wound care, basic things like that. So all in all, it's the degree of flexibility that is my role, of putting on all the different hats.
I could hear in each of your responses this thread of mutuality and compassionate service, which is what we talk about as mercy volunteers as a characteristic of service. I'm wondering if you can speak more to what it means to you to serve in the spirit of mutuality and serve compassionately. Rachel?
Yeah, so I think compassionate service, I think this year having so much time to reflect on the service that I've been doing has been really helpful in me to better my service, to realize just what I can do better to help serve the people that I'm working with, but then also how I can better work with the other people that I'm working with, like my coworkers. And I think also just kind of really listening to people, because there are so many folks who just don't have anyone to talk to. So that has been something that has really been on my mind during my service here. And then also just treating folks with respect and dignity, because there are so many people that we work with that people just walk by and don't even say hi or anything. And just being able to sometimes just sit next to someone and have a conversation with them, see how they're doing. But I think also the service, living in mutuality as well. I think kind of realizing that, so this year we live on a stipend, and I think it's been helpful not having all the extra things to help also better connect with the people that we're working with. Because especially for the folks I work with, having a meal that day is something that's an extra thing sometimes. So just it's really helped kind of connect, for me to connect better with the people that I work with.
Nolan, how about you?
So I like what Rachel was saying about being able to talk to the people. I think the biggest part of serving in the spirit of mutuality to me is just sitting down and not being afraid to spend the time. Even if you know you have a busy schedule, there's a lot going on. Sometimes going that extra mile really makes a difference in how they see their care and the energy that they have with all of that, really wanting to stick to their plan and being excited about taking good care of themselves and their health and making positive and healthy choices as much as they can with the resources they have. That can take different forms. A lot of the times it's just sitting down with them and being thorough with teaching, of instead of just sending them out the door with a packet of paperwork and saying good luck. It's sitting down and highlighting and talking through each thing until they feel confident that they have a good understanding of what's going on. I feel like so often that happens where we're just handed a packet, good luck, but just not being afraid to spend that time. Another beautiful quote I heard was to treat your patients and see your patients as if they were your family members. And I think that's helped me to serve in a spirit of mutuality as well. Of if the sweet little grandmother and sitting in front of me that I'm drawing blood on was my own grandmother, things like that. So just seeing people as people, sitting down with them, spending the time, each of those things have done it for me.
Yeah, I definitely agree with both of the others that, listening and just having conversations is such an important part, both for, the clients and for us, as individuals. And that's the whole mutuality piece, is like every day, my clients, they're the ones that I'm working with. And the stories that they've given me and the messages and the lessons learned from them are just incredible. I'm working with a clientele who has lived all around the world, and has gone through so many different experiences, and I've just gotten to learn so much from them. So that has just been so exciting, and really shows how this type of work is so mutual, and that we're both, gaining so much from it. And I think that the way that I approach that is just having conversations, like people said, and trying to, legal work can be very, rigid and very paperwork and bureaucratic and different things. But what's nice about my position is, you have these cases from start to finish. So to just focus on the paperwork and the legal aspect of that would just be such a disservice, to the people and to your relationship with them. And I think at Catholic Migration Services, people, that's not how it operates. We are a legal services organization, but we are our clients will come to us with other things. We also sometimes refer them to other units, the housing unit, the workers' rights unit. We're there for them, a little more holistically, and enjoy or appreciate those conversations and really seeing them as a whole client, not just their legal work. So that's really how I approach it all, and definitely approaching my work that way has benefited me in so many ways as well, and hopefully our clients as well.
Wonderful. Thank you. All about relationships that you're building with people, whether it's the one time that you see them or for continuous services and care. So as we approach service, we think about the critical concerns of mercy, which are immigration, nonviolence, racism, women, and care for the earth. So I'm wondering, at your service site, whether it's the service site as a whole or your specific work, how do you engage in those issues of justice, and what role do you feel like you get to play as an agent for change? Nolan?
One that comes to mind for the clinic is women. As primary care in the community setting, there are various things that we can do in the realm of women's health, in the realm of public health as well. Among the most prominent are the pap smears that are performed at the clinic by the nurse practitioners, and the MAs and myself are able to help out with those. Aside from the pap smears, we do various other testing and pregnancy testing as well. But the biggest one that comes to mind is our mobile mammography bus that comes from our hospital system, St. Joe's Candler, and comes and parks right in front of the clinic. So that's a way for our patients to get free mammograms that they may not be able to have done otherwise. So being able to provide more so the medical services to empower women with their health.
Yeah, of course, at Catholic Migration Services, it's mainly focused on immigration. That's its biggest unit. So of course that always comes to mind. But I think I've learned this year how connected they are with other ones. Of course, we focus so much on immigration and the humane migration of people and enabling people to be able to migrate. But I've very much noticed, that it interacts so much with the other ones, like women, for example. Some of our clients, they need our services because they're fleeing situations of domestic violence, or fleeing a place that there was a bad situation or something, and having access to be able to still keep their immigration status, or if it was a marriage to a US citizen or something like that, they need legal help in order to do that. So we definitely see a lot of intersection with that, or racism. We see that people are fleeing areas in countries where they're not welcome, and people are helping them apply for asylum through our organization. So although I would say immigration, of course, is the main critical concern, it has very much become obvious how connected they all are working at Catholic Migration, because they're also connected, and I see it in our clients and the situations that they bring to us all the time.
The more I reflect on these, I can see how my service site kind of connects to all of them. But I have to say, I would say the most that stick out would be racism, women, and nonviolence. Because with the people that we work with, we find that predominantly most of folks who are experiencing homelessness in Philadelphia are Black BIPOC individuals. And there have been more women more recently that have also been experiencing homelessness. And just seeing the services that are offered, there aren't very many, like there aren't as many shelters for women as there are for men. For women and families, there aren't as many. And that has definitely been a disservice to folks, especially in the winter, when shelters fill up because of the cold, and trying to find a place for women and families to go to. And also nonviolence, because I think homeless outreach takes a different approach than other services in Philadelphia, like because we don't have anything necessary. We don't have like weapons on us to protect us in a way, because we really believe that what's going to protect us is our relationship with another individual. And that I think that having some kind of a weapon on us would kind of break that connection with other people. So yeah, and then I also see how immigration kind of connects to it. Philadelphia, I know they accepted 900 folks from Afghanistan, and there are a lot of agencies that have helped out with that, but there have been people who have come on their own to Philadelphia. And I've had a few people call into the hotline who are seeking services, who were fleeing their home country.
Yeah, thank you all. What are some of the gifts and challenges that you experience in your role? Emma?
Yeah, so the gifts, I think, as we've kind of been talking about, of course, is just the interactions with clients and the everyday conversations with them. That is by far the highlight, and seeing them become citizens is so exciting and so awesome to see. And it's very, I will say, it's very, very rewarding work. There's some immigration work that's a lot harder, and the cases, like an asylum case, for example, it can take 10 years or something. So it's very delayed, and in the end, you might see a client get sent to a country they don't want to be or something. So with naturalization, which is what I work in, it is, I will say, one of the more rewarding works in immigration, in that you get to see them gain a positive benefit. It's not just like negating a negative of any sort, and it's a lot shorter. These clients, anywhere from 3 months to like 15 months is when they'll become a citizen. So I've gotten to see clients, my first clients are becoming citizens now. So that's super awesome to see, and just the relationships I've built with them. Another gift is definitely, I'm very interested in the law, and working at Catholic Migration Services, especially in this position, you get to see a lot of law and a lot about immigration law, but even like criminal law and the interaction between criminal law and immigration law, and different things. You're, requesting dispositions from courts. You are seeing how that interacts with someone's immigration history. Sometimes we need to do case analysis to figure out where this person, what this person should do. So it really has been awesome in that. I feel like I've been exposed to so many different things in the legal world and learned so much in my short time here. So I'm very thankful for that. And Jose, who is my supervisor, he's been running this for like 8-10 years, the volunteers, and he does an amazing like orientation, and we get to attend like legal like webinars and stuff too. He's always like encouraging us to learn. So that's super awesome. So I also think that's a big plus to my position and something I was really looking for. As for the challenges, I would say, I think all work in this arena kind of has this, but it is a lot of work, like, and you're juggling a lot of different things, working with a lot of different clients. It's, important work. It is not something you want to mess up on. These are people's, immigration status is very important things. So I think it is, a lot of work, and, you definitely have to put the time in and the work, and the effort. And it is, there's a lot to learn very fast, but definitely worth it. I think from my end, that it has been just so great thus far. And I know that like what I've learned and everything will definitely keep helping me into the future as well.
I think some of the gifts that I've experienced this year would just to see how people have progressed over the year. I think back to some of the folks that we've worked with. This one gentleman, when we first met him, he had this massive wound on his leg and his hand, and we've been working with him consistently the past 2 months, and meeting him almost bi-weekly with our nurse to treat those wounds. And he does use, and just kind of seeing how he's progressed, and now he's interested in going into treatment when at first he wasn't interested at all. And we now have him connected with this service that will help him get treatment, but they also get him housing first. So that's exciting for the next couple weeks. We have the referral in, so he's excited about it. He needed to get a psych evaluation to be able to get that referral in, and he kept on reminding us. He's like, when am I going to go for the psych eval? And you could tell how excited he was about it. So just really helping people to be self-determined to do things on their own, but then also helping to empower them to be able to do those things. I think on the flip side, the challenges could be when folks just decide not to receive any kind of services, or you were so close to getting them into a shelter and then they're like, oh, you know what, maybe next time, which can kind of be discouraging, but really it's up to them, and they get to make the decisions. So even though it's not something that I wish they went into shelter, especially with the summer, it's going to be hot, but really it's up to them, but also not giving up on them, still meeting them as much as we can and providing them food and water and snacks and anything that they may need. So yeah, I've definitely learned through this experience more patience. I've never been a patient person. And I've noticed too, like I've always wanted to get things done. And with our people, like you see them one day and then you may not see them for another week, just because they move around so much. And so I have this tendency when I see a person, I'm like, oh, we need to do this and this and this. Let's get it all done today. But really being patient and working at their speed. So maybe doing one thing today, and then the next time that I see them, we'll do something else on the to-do list to get them where they need to be.
So at the clinic, it is throughout the year so far, certainly very fulfilling and very rewarding work on a day-to-day basis. We see the same patients, although we do have quite a few patients. We do see them coming in for example, like a 1-month follow-up, 3-month follow-up, 6-month follow-up, what have you. We end up seeing them at some point. So at that time, each time they come, we check their labs, we check their vitals, and see how their numbers are doing. I think with a lot of our patients, they have one of the 3 kind of general chronic problem areas of having high sugars, so diabetes, high cholesterol, or high blood pressure. And a lot of our patients work really hard to get those things down and to take care of themselves for the sake of their own health and for their families as well. So it's rewarding to sit down and make a plan with our patients and help them feel confident in what they're doing, but then also having them come back, being able to do those services with them and end up seeing the results with them. And when we see the results, it's a matter of celebration. We celebrate the wins with them because you have to. So many of the time, there's just such great joy in the patient rooms where it's the nurse practitioner and I and the patient all cheering when we see the numbers come out or seeing how they've been. On the flip side, it's not always a victory. Sometimes life gets in the way and things happen and it doesn't come out as planned, but it's a matter of feeling through it with the patient, sitting down with them, spending that time and seeing how we can get up on their feet, which leads to an even more rewarding victory. So aside from that, some of the challenges that I face at the clinic are sometimes the busyness. The busyness is the biggest positive, but also a challenge, and that's part of it. Like I said, it's a lot of work. For example, I could be in 3 different patient rooms doing something at a given moment, or I could be helping in the lab doing a blood draw, or I could be running a test, or I could be doing vitals, or I could be doing an EKG. There's always a need, which is a wonderful opportunity, but it's also a reminder to focus on the one thing that I'm doing in the moment. When I'm able to take a deep breath, focus in, and really remember to do that as best I can, I found that is certainly the best route to take. Yeah, I think that this year has taught me patience as well. Patience, also focus, and confidence in doing so. To not being afraid to take that time, take that deep breath, and really focus in on what's important in the moment. Yeah, so for all of those things, it's made it very rewarding work, even given the challenges. The challenges are okay, it's part of it. But given all of those things, it's been a great experience.
And we are grateful for each of you and the work that you put in and all of the good things that you are doing. I know you're coming towards the end of your volunteer year, which I don't know about you, but that's hard to believe. It feels like we just were together at orientation not long ago. But thinking about your experience throughout the year, how has that impacted what you see yourself doing next? Has it affirmed what you wanted to do? Has it changed? Where are you headed? I think Rachel, you'll start.
Yes. So I kind of think back to when I decided. So I majored in social work, and originally going into that, I thought I wanted to work with kids, and especially kids who have had traumatic experiences growing up. And through my internships during school, I kind of realized I wanted to do more community-based work. And so that's why I decided to work with Project Home and doing homeless outreach. And I have really come to love just the work that I do. So much so that I'm actually planning on continuing on with Project Home. Hopefully as a case manager, where I'll be working with walk-in participants or clients. So yeah, that's exciting news. But yeah, I realized that this is something that I don't know, I could potentially do for the rest of my life. So yeah.
I'm happy to say that I've had a similar experience. I double majored in nursing and Spanish in college, and I knew that I wanted to work with Spanish-speaking populations in the medical setting. In my clinicals in college, I got a feel for the community-based work, more the public health, and fell in love with it. And this year did everything to affirm that, very much so. It gave me a very clear window into the world of community health, where we encounter each of the social determinants of health on a daily basis with our patients, given problems with transportation or whatever barrier it may be, to prevent them from having the best care possible. Yeah, certainly has affirmed my passion and desire. Given this experience with sharpening my nursing skills, as my first year as a nurse in the clinic was a great place to do so, but also my language skills in Spanish. Given those skills, I'm looking to be a public health nurse in my hometown in Wisconsin. So given the wonderful experience this year and kind of both of my skill sets, I am excited to be able to continue that work.
Very similar for me. When I chose the position at Catholic Migration Services, I knew it sounded great, and it has definitely lived up to that. I've always been interested in legal work. I want to go to law school, and I also wanted to be on the ground at this time. Like, I wanted to be right with the clients, working with them, and that's exactly what I got. I got to be in a legal setting that was working with individuals daily, and I loved it, as I thought I would. And so I definitely want to stay in this work. And I also love New York City. To be able to be here is incredible. So next year I'll be doing very similar work, like case handler, working with people on the grounds, but in legal work. And then after that, we'll go to law school. And I would say that I think this position is very helpful. Like I said, you get to see a lot in the legal world, and like it does help a lot for your professional development. And if you're looking to go to law school or to pursue a legal career of sorts, I've already seen it paying off, as I'm looking for things next year and doing things for next year. So altogether, great experience, definitely affirmed what I want to be doing, and has helped me progress down that path.
Yay, so excited for all of you and what life's journey will be for you next. We did get a question in our chat from one of the viewers. Marley says, first of all, thank you guys so much for sharing. Your work sounds amazing. I wonder if you have ever had any negative experiences or felt threatened by any chance during this year. If so, how did you deal with these instances? Anyone wants to just jump in, unmute yourself, if you have a story to share on this.
Yeah, I can jump in. Thank you for watching us. But I think that, I live in New York, and obviously, as there is in all big cities right now, kind of, crime is up, and there are different things. I've never experienced it at my workplace or anything, but I do think that, there always is a risk there, and we've seen that with certain incidences and things that have happened in New York City. And I'd say that, we're all vigilant when we're out and about, but I would say that, first of all, Mercy Volunteer Corps has been very good about it, always, giving us anything we need to ensure, we feel safe and supported here in the city. Our support people, they're right next to us, and they are great. And we live in such a great area, and all our workplaces are extremely supportive of us and everything. So I've never felt an instance where I didn't feel safe here, but I think it's a fair concern that I know people have felt, not just people working in these areas, but just living in cities and in the world right now. So I don't know if I'm at any greater risk than anyone else, but it definitely is something that I know has been addressed this year, and that I felt very supported by Mercy Volunteer Corps and by my community members and everything. If anyone has an incident where they run into someone on the road or something, everyone's been very supportive. So I don't know if it's any more, I don't know if that really answered it, or if it's any more, doing this than other things right now in the world. But regardless, I know there's a very good support system in place if anything were to happen or something.
Yeah, and just to echo what Emma said, I think I personally have never experienced any like a situation where I necessarily felt like I was in danger. I think especially in my workplace, safety is our number one goal. So if there's anything that makes us like you just react, just making sure to react to your gut reactions. And if something doesn't feel right, get out of there. So really, because your safety is the most important. And yeah, I think in the city as well, like it's just making sure you're aware of your surroundings, not being on your phone when you're walking, and yeah, just making sure you're just like aware of what's going on around you.
To echo that, I also haven't had any personal experiences, but I can speak on the safety of the clinic that I work at, very safe and secure environment, as well as I know in our cities, if you ever have any questions or want to talk through anything like that, each city has a support team through Mercy Volunteer Corps that can give you advice on living in the city, kind of like Rachel was mentioning, just tips and tricks to be able to look out, know your areas, know your way around, and general advice. And of course, the staff at your workplace, your supervisor, would be very supportive in that as well to address any concerns, any questions you may have at the beginning.
Yeah, thanks for your question, Marley, and thanks everybody for giving your perspective on that. So to close us out for tonight, do you have any pieces of advice for people considering a year of service in general, or why someone should serve at your service site? Rachel, do you want to start us on this one?
Yeah, I mean, I think doing a service year is such a great thing to do, especially if you're not certain what you want to do, because it allows you to kind of explore a different opportunity that you may not have thought about doing or even considered. But also, I think this year for me especially has been really great to like just to be more intentional. And I've been more intentional with my time. Even though I have my routine, it's done with intentionality. And even like living with my community mates has been amazing. Where they've all been very supportive. We've all been very supportive of each other. And with the ending of this year, we've all have kind of been getting a little bit more busy with preparations for next year. So even though we may not have been spending time together as much, when we do spend time together, it's very intentional. So yeah, this has just been a really great experience for me this year. And what was the other question?
Why someone should serve at your service site?
Yes.
Mm-hmm.
I mean, it is such a great experience. I just have to say, I mean, if you love people, you will love working at Project Home. I mean, I think really just having a compassionate heart is really the best thing for this job. And just being able to interact with people. My coworkers are all amazing. They're all super supportive. My supervisors are very supportive. And like, we're just like a little family. So yeah, I mean, I think if you're not sure what you want to do next year, a service year is like a really great option to just kind of explore another opportunity. And yeah.
Mm-hmm. My advice to someone considering would be to have an open mind and an open heart, because so many wonderful things can happen during a year of service that you would have never expected. The people you meet in the city, the people you meet at your service site, the wonderful people you can meet in your support team, the skills you'll pick up, the random hobbies you might pick up, the fun things that you would share with community members, all the memories that can be made with that time and intention, yeah. And the time and that level of intention. So having an open mind, open heart. For anyone interested in the Good Samaritan Clinic, I think it is a wonderful place for people with all sorts of skill sets. Personally, mine was more medical. If you are a clinical medical type person, there's always work to be done. If you're on the more administrative side, certainly lots of work as well. And for those looking to sharpen their Spanish skills, plenty of that as well. So plenty of opportunities and plenty of room to grow given your different skill sets. The staff, it's a good way to say family, tight-knit, pretty small staff. And they are among the sweetest people I've met, and laughter and joy fills the clinic on just about every day. So it's a real easy place to go to each morning, even if it is real early for the morning labs. So yeah, both Good Samaritan and the clinic overall have made an excellent experience. And I would keep your mind open, think about it, keep talking, keep learning. It's worth it.
Yeah, I think my advice would just be, do what you want to do. We are young and have our whole lives to settle down. So I'm so glad that I took this opportunity, and whatever opportunities you have in front of you, I would just say, take them. When you're young, I still feel very young. I feel like, oh, next year, who knows? We'll see what I do. So I would say go for it, whatever it is. And as for my service site, definitely we'll put the plug in for them. It is incredible, has been incredible working there. Professional development has been great. My experience, everyday experience, I like what I do. It's incredible. And living in New York is a dream. Living in New York rent-free, even more of a dream. So I would say go for it. And Catholic Migration Services here in New York City is awesome and such an opportunity. And you should do it.
Yay, thanks everyone. Thanks for those who were able to tune in tonight. If you have any questions about Mercy Volunteer Corps, feel free to reach out to us at mercyvolunteers.org. If you're interested in talking with a current volunteer or an alum of the program, we're happy to connect you with anyone. So we are accepting applications for the upcoming service year until June 20th, and you can also complete that on our website. Thanks again to our volunteers, Rachel, Nolan, and Emma, for taking the time to be here tonight and share a little bit about your service site. Have a good night, everyone.
Bye.